Hello, my name is Kendra Miller. I'm a licensed clinical social worker and mental health professional. I want to talk about suicide today. I know it's a tough subject. It's something that we don't normally speak on in just general terms or in regular conversation, but with the amount of suicides that we have in this country and around the world, it needs to be normalized. We need to help others learn how to assess for warning signs and when we need to help others along. So we're going to break it down by letter. So the word suicide, I'm going to start with the letter S and I, and as we go along, we'll catch each letter, and I've made it kind of an acronym to kind of do this in parts so that we can understand better. So, suicide, suspect. If you suspect that someone you love, someone you know, someone has come to you and told you that they're having a hard time, how do you talk to them? How do you relate to them? So, first, you need to check in with yourself. You need to understand how you feel about someone dying by suicide. If we're judgmental, if we come across as that person that says, "Oh, you're not thinking about suicide, are you?" That's not the way to approach a situation. First, we need to get to know others. We need to be comfortable with listening. A lot of times when people have problems, we want to be the first one to help them problem solve. But sometimes we don't need a problem solve in the moment. Sometimes we need to just be a listening ear. And as we're listening for signs of despair, hopelessness, listening at the words that people are saying. And with that, we stop, we pause for a minute, and then we offer some suggestions. But first, we have to look at what is it that we want to do? How can we help? So we go to the letter I, identify. When we have identified that something is wrong, the person is in despair, they are disclosing some hopelessness, they're using certain words as "I just don't want to be here," "I don't know how I'm going to make it another day," we need to unpack that. If we feel comfortable, we need to sit with the person, maybe take them out to eat, do something that just kind of brings them away from that current place, or go to a quiet place if you can. Like if you're at work or if you're at school, sometimes you can't just speak on these things openly. If you're hurting, you want to stop the bleed. And so we have to look at suicide the same way as we look at CPR. We don't let someone just stop breathing without trying to offer some rescue breaths. So the same thing has to happen with CPR for this. I'm not going to just sit there and watch someone bleed out. I'm going to call for medical attention. If someone says that they're thinking about hurting themselves, I'm not going to just go home and just say, "Oh, I hope they don't do it." No, I want to offer help. I want to offer suggestions. I want to offer resources. I'm a mental health professional, but we have to look at most people will not engage with a mental health professional. They're engaging with the people they know, the people they trust, people that you're around. So we have to get to the point where we're forming community again. When someone is isolating, another I, they tend to go into a shell, and we start to think that no one understands us, no one is going to listen to us, no one wants to even know what's going on, because in isolation we start to go into our own thoughts, and with that sometimes comes despair, depression, sadness, anxiety, all of those different things that happen. But also there's a level of mental illness sometimes that goes undiagnosed. So if we're talking depression and anxiety, that's one thing. If we're talking bipolar disorder, schizophrenia, or something like that, that's different. But those people can still be at risk as well. So sometimes you just need to know who and what you're dealing with. But if you've identified your person, they've disclosed that they are thinking about hurting themselves, we need to understand our role. How do I feel about this? But don't make it about I can't make it about myself. You can't make it about you. You have to try to connect with the person and offer care and compassion. And we have to look at what resources we have available. Each state usually has some kind of suicide prevention program, and we break that down into cities. So that's the time to actually look it up online. You also have 988. You can text that, you can call it, and someone will be available to help you through next steps. NAMI, they're a wonderful resource. I don't work for NAMI, but I have utilized them for clients, for friends, for loved ones, for people I don't even know, because we need to understand who is there to help us. So in our telephones, a lot of times we have all the different apps, we have all the different things, but do we have a resource for if someone tells you that they are thinking about hurting themselves? Most of the time we don't. We need to have our own little resource center in our phone to be able to pass someone on to the next steps. And as we get more comfortable with showing care and compassion, we have that listening ear. We have that time that we make for the other person that needs our help. And sometimes we need a little hand holding to get to the next place, but that doesn't mean that you just drop them off. You're checking on them. You're trying to understand, what your role is, but not being intrusive, allowing the person to speak when they're willing to speak. Normalizing the fact that everyone goes through something. How it affects them at different parts in different times of their lives is something else. So when we identify risk factors, there are a lot of different risk factors for suicide. Most of the time when someone is thinking about hurting themselves, they think that they are alone and that no one else has had these thoughts. And as you are working with someone, that may or may not be the time to disclose your own journey. You have to kind of assess the situation and see if, disclosing or sharing how you have gone through things can actually help the person. Because sometimes as you're talking, that person starts comparing their lives to yours and it just doesn't fit and they become afraid and then they might isolate even more. And that's why I'm saying listening more than you actually talk or share your own journey. There's stigma attached to suicide. And we have to understand that we have to educate ourselves on what it means to actually get help. And if someone discloses something to you, we have to decide how are we going to proceed to the next step. So as we continue this series, we're going to look at different ways you can assist someone with moving to the next step. So I want you to educate yourself more on how you personally feel about suicide. Look up the different terms. The one term I really want you to look up is ideation. And as we move into the next segment, which will be the U, we'll talk about understanding. Understanding your role, understanding the whole mental health system, and understanding how community can affect helping someone move to health. With this series, we hope to provide you with different ways to communicate with others, help you gain better understanding of how you personally feel about suicide and how you can help others. And we also hope that as you continue in your own journey to assist others or to even help yourself, that we can approach others with love, care, and compassion. Thank you.